Welcome, everyone. Thank you for joining us today for our Foster Care and Mental Health Month virtual forum. Today, we're coming together to show solidarity and spread hope in our shared experiences and learn about some of these strategies. We have with us Zaria Georger and Kim Kaiser from Families Together in New York State. Hopefully you all can see her, both of them on camera. Working a little bit behind the scenes, we also have Brad Hansen, our Public Policy Director, as well as Zach Kelmer, who will be monitoring the chat. So throughout this webinar, the audio will only be for the speakers, and so we encourage you to utilize the chat feature to participate and engage in discussion around these topics. And if you have any questions, do not hesitate to submit them to us, and we'll be following up with the responses. And with that, let's get this started.
Hi, everybody. My name is Kim Kaiser, as Brianna said, and I'm with Families Together New York State, and I want to welcome all of you here. Before we get started, I want to know who's here with us today. If you could just do this quick poll, we'll give you a few minutes to respond so that we have an idea of how many of you are in the audience and where you come from, okay? And Zach, you can let me know when we're done.
Okay, just one more moment and then I'll close out the polls.
So I see we got a nice mix of, we have some foster care youth, we have former or current youth involved in the mental health system. We have some parent caregivers involved in the foster care system, some involved in the mental health system, and we have a lot of other. And I would only assume that those are other collateral people involved in the individual's lives, youth, bio, foster. All right, so let's move on. So let's talk about why we're here today. First of all, here at Families Together, we represent families and youth with a variety of social, emotional, behavioral, and cross-systems challenges. And our goal is to ensure that all youth have the support needed to succeed. We represent thousands of families across the state, and we support them through mental health, substance abuse, special education, juvenile justice, and most importantly for today, foster care. So we have to realize that the time to act is now. And because over half of children and youth with diagnoses do not get their needed treatment. And whoever lives this can feel it. All of us are the end users of this system that needs to change. And the change is only going to happen when we use our voices. New York ranks 3rd worst in the country in placing children in foster care with permanent homes. And there's gaps in services that we all know existed prior to COVID-19. Those gaps have just gotten wider. Here's a little analogy for all of you. When a flower doesn't bloom, you fix or support the environment in which it grows, not the flower. So what we're saying here is that when a child is growing in our society, in our community, in our household, and there's something wrong, it's not about focusing on what we perceive to be wrong. It's about supporting what we can do in the environment and what we feed our youth, what we give them in terms of support, what support we need. We change the environment in which it grows, which will provide for them the tools that they are going to need to meet the goals that they set and to help them fulfill the dreams that they have for their future. We also have to remember that we will repeat what we don't repair. We will repeat what we don't repair because we have always got to take action when we see things that are broken. And that involves taking certain actions to address things such as mental health, the youth that are the end users of the mental health system, our foster care system, and that includes the kinship, the biological, as well as the chosen family that are involved with the youth. Foster care, kinship, or chosen family are a vital part of the success or failure of our youth. It's the love that needs to be matched. The love that we give them needs to be matched with the tools that they need and the tools that we need to succeed. And those tools will help to repair the past, and that means addressing certain mental health issues and trauma. It will impact their present, which means building a level of self-efficacy and a can-do attitude about their future. And hence, we will change the future. Mental health, training, and support for the entire foster family, the engagement of biological kinship, professional, and the child's chosen resources. And the old adage is it takes a village, always stands and rings true because it is true. And for foster parents, of which I am a foster parent, we understand that we might be temporary in their lives and they might be temporary in ours. But we have to understand that there's nothing temporary about the love or the lesson that we're here to give them. And that really rings true for foster parents, biological parents. Any resource in a youth's life is there to give love and also to give a lesson. So the services that we want have to be youth-centered. They need to be family and foster care centered, and they have got to be future-centered. We have to engage our youth in ways that supports their dreams. We have to prepare them for success because every child deserves a backpack of hope, love, and skills, as well as education as we put them on the road to their future. Every part of their life where they are getting support must also be supported. That includes training, financial support, emotional support, and all of this needs to be provided for their biological family, their foster family, the kinship families, as well as everyone else that the child has chosen and has focused on as their circle of support. We need to have expedited permanency hearings. We need to have very solid goals for reunification that reflect a young person's input. When I started my career back in the 80s, I started in child abuse investigation. I moved on to foster care and permanency planning. I was working at a time when the youth's voice was not heard. The changes that you see today are the result of people then standing up and planting a seed. A lot did not change for the young people that I worked with, but as I moved forward and beyond that role in my life, I started to see the seeds grow and cultivate. I started to see changes such as moving that discharge date from 18 to 21. These things make a difference because we are here to love, teach, and mentor and prepare youth for the future. And that involves everybody around them. And I'm passionate about this because my last name is Kaiser, and that name came from a man who adopted my father. So I have a passion for this that really goes beyond the fact that things need to change. It's very personal to me because my life could have been very different if it wasn't for the fact that there was an adopted parent that stepped into my father's life. Next slide. We have to learn that we need to change what is into what should be. You and I are the best advocates for change. Foster, bio families, the youth involved in the system, and the community that supports them. And we have to remember that foster care and mental health are personal, social, and political issues. Political voices tend to mimic the voices of change. So we need to be the voices of change, because eventually the politicians will become our mouthpiece and we will see change. The history of advocacy has shown a lot of changes in the system. We're not there yet. We're not where we were. But every time we see gaps in services and things that are broken, such as the things that are going on in New York State right now, we have got to step up to the challenge and make our voice heard. And we do have to remember that not everything that we face can be changed, but nothing is ever going to change until we face it. Everyone is sitting in the shade of a tree that was planted by somebody else. And that's what we want to do. We want to be future oriented. We want to speak up on behalf of our families and our youth receiving foster care and mental health services, and make sure we affect positive change. Yesterday is gone. Tomorrow hasn't come. And we only have today. So with this webinar, let us begin. I'm going to pass this on over to Azaria right now.
Thanks, Kim. So, hi everybody, I'm Azaria, and I wanted to share with you briefly that I myself was in care. When I was younger, I couldn't really wait to get out of the foster care system. And I actually changed the age out from 18 to 21 while I was in care, which was really relieving in the circumstances. And I was able to go to college and get support to do so. I had somewhere to go on vacation, and luckily I had and still have a relationship with my foster family. When I did turn 21 though, I was living in the dorms on campus. So for some, this would have meant homelessness, especially during this time of COVID. So one of the big things that I want to talk about, or actually advocate for, is the pausing of young people aging out of care to at least 180 days after New York State on pause has ended. And another issue is the important to me is mental health. As someone who has struggled and continues to struggle with mental health issues for young people are trending upward and could potentially get worse due to the COVID-19. But funding for treatment and support services are in jeopardy right now. So we're asking that funding is increased for telehealth services and the infrastructure and behavioral health screenings and clinical care to support young people getting their needs met, especially around mental health. And my quote is, "Time, as far as my father was concerned, was a gift you gave to other people." And that's by Michelle Obama. And I just hope that we can continue to support young people moving forward and giving them that foundation to get their lives off on the right foot. And I'm actually now going to pass it off to Brad.
Thank you all so much. I was really moved by both Azaria and Kim. You guys are amazing. My name is Brad Hansen. I'm the Public Policy Director at Families Together in New York State. Just want to go over very quickly some of our advocacy and policy goals, what we're hoping to get from this webinar, and what we're trying to accomplish now as we respond to COVID and really honor Mental Health and Foster Care Awareness Month, which is the month of May. You know, we really want to place families and youth front and center in our advocacy. That is really crucial. There are a lot of different voices that come to the table, service providers and government officials, county leaders, but we feel it's our role, and it's a unique role, to ensure that families and young people have a place to advocate within the system, as Kim had spoken to so eloquently. We have to improve the mental health and foster care system. We have, as Kim has said, we've really moved along. You know, in the past couple decades, things have been improving. But in this clear and present moment, there's always been someone who pushes things forward and then prevents things from going backwards. And that's kind of the moment we're in right now. We have a lot of forward momentum, especially in New York, but I would say even nationally, you know, mental health is recognized more broadly than ever as crucial, and especially when it comes to children, addressing trauma, which is crucial to foster care and really everyone. But we can't move backwards as state legislatures are dealing with huge budget deficits as a result of COVID-19. And so it's going to take all of our collective voices to prevent that from happening. We also want to speak to and hear from you, exchange information about how COVID-19 has impacted your community. What unique needs are you seeing for the various populations, especially young people in foster care and families with mental health challenges? How do we amplify, how has COVID impacted existing needs, things that existed well before COVID, we'll be talking about. And then lastly, you know, what we hope to achieve here today is uplifting the experiences of affected people, exchange insights from our community, share ideas for advocacy, and inspire efforts to advocate together. Next slide. So jumping forward here, you know, it's crucial to discuss where Families Together is coming from. And, you know, I first want to point out that we are leading members of a campaign called CHAMPS New York, which is an imperfect acronym for Children Need Amazing Parents. Don't try to line it up. It won't exactly fit. But our main focus is ensuring that family-based placements are the primary intervention, and that foster parents and youth in care are getting the supports they need to maintain those placements. And what this does, and what we know for a fact, is that young people who are placed in stable, strong foster families tend to improve or tend to have better outcomes overall through the trajectory of their life. More likely to reunify with family, more likely to have strong connections with kin, and more likely to go out and succeed, as opposed to what we're seeing when young people are placed in congregate care settings. These are things like group homes and institutional settings, residential treatment centers. New York is unique. You know, we've made a lot of progress when it comes to prevention services in New York, but where we're falling short compared to the rest of the country is how often we default to placing young people in these institutional settings. Family is necessary for young people to heal and to grow. Congregate care cannot be a replacement for family. And so we have been pushing very strongly in New York for the past several years to ensure that those numbers of young people being placed in congregate care go down, and that more young people, as they approach that aging out age that Azaria was talking about, have a connection to adults who care about them, who they belong to. And that's a really crucial piece. So that is the heart of what we are trying to accomplish. There's a lot of numbers, stats, policy goals associated with achieving that, but that is what we are trying to do. Trying to make sure that every young person has a family. Next slide, please. So on the other end of this webinar, and today's topic is children's behavioral health. And, you know, these two issues are tied intimately together. Any young person who experiences trauma is more likely to experience mental health and addiction issues at some point in their life, or substance use disorder. And we are seeing that young people in New York, even, you know, are in so many ways expressing symptoms or experiencing challenges related to behavioral health issues, and yet New York is failing to improve their access to services in meaningful ways. You know, we have made some major advancements in the past couple years, and we're proud of those things. You know, expansion of Medicaid managed care, in theory, is a good thing, but if we don't put funding behind these things, and we don't make sure that they are getting out into the communities where people need them, you know, we're going to fall short of our goals. And that's what we're seeing in some of these stats here. 54% of children with mental health or behavioral health condition who needed treatment or counseling did not receive it in the past year. And yet we're seeing increases in suicidal ideation and completions. And those are alarming stats. And we have to make sure that New York meets this moment and it addresses these things. And It's even in more danger now that state funding is experiencing high deficits. You know, there's billions of dollars that we're trying to make up for. Our voices are so important to make sure that we don't go backwards at times like these. And so that's the context that I think we're operating in right now. So we put out some polls. We put out a survey for folks. We wanted to hear from you before we started this webinar, so we really get a sense of, at least with the folks that were participating, what things they're seeing. And I think this is a great time. I'll repeat the question, and if you already filled out the survey, feel free to sit this one out, but there might be things you didn't think of that you'd like to include here. Feel free to jump into the chat. Let's start a conversation. I'll just read out the question. We asked, what can communities and systems do to support the wellness of families and young people that is currently not available? We had some great responses. COVID-19 really seems to be driving new issues or existing ones. Things like, okay, everything's moving to telehealth now, but including schools, you know, every person that's in a young person and family's life. But does everyone have access to the technology? Do they have enough devices? Do they have fast enough internet that can accommodate, you know, multi-person household having, you know, with multiple children doing school at the same time? You know, these are crucial things that, you know, you've raised in your response to the survey. Some of the things we've spoken to, like adequate funding. I can say with no uncertain terms that there wasn't adequate funding prior to COVID-19. And what we're experiencing right now is a generational trauma that we're going to talk about for a long time. We're going to remember this, and young people have a huge set of experiences related to this. Families are going to have different experiences related to this, and we need to put state funding forward to make sure that we are prepared as a community, as a system, to address it. And so thank you so much for folks who raised those kinds of questions. I'm going to look, we're getting some discussion, some questions in the chat now. Someone says more availability of books. Some students borrow needed books from their library that they cannot access anymore. That's huge. That is such a huge piece that, you know, and we appreciate you bringing that up. It's not something that we can, that, you know, at least I could speak for myself. I see Kim nodding along. This maybe was an issue that she's overheard, but it's not something that, you know, people in the policy world are actively focused on. But that's a huge point. You know, how are people accessing their textbooks? How are people accessing knowledge? And public libraries fills a huge hole for a lot of folks. And I don't have a good answer for that. I don't know if anyone wants to jump in.
Brad, I wanted to just kind of point out here, a lot of people are sending questions, sending their comments in as questions, and we ask that you send it in as in the chat box, I think, right? Brad, I think you covered that well, by the way.
I appreciate that. I see another, Zach's forwarding along some stuff to us. Another one is, unfortunately at this time, personal support. As you point out, so many do not have access or the knowledge of how to use it. Building up natural supports is one thing that we have to do regardless of what government is gonna do for us, you know. And we, in our communities and Families Together and the Youth Power Network, we know that intimately, that we have to be our own supports, and, you know, we have to be there for each other. And that's true now more than ever. I don't know if Kim, you want to speak to that sense of like mutual support going on.
Yeah, I do want to say to everybody on the call today that, you know, the bottom line is nothing will change without us lifting our voices. Nothing is going to change, because the people who don't know it, don't experience it, are not going to hear it until they hear from us. So whatever we're going to do, we have to do in our communities for each other. And yes, everybody needs more outreach coming in to support them. At the same time, we need to do more outreach to the change makers to make our voices heard. And that will be through advocacy. I like the more peers as well, because more peers is more support across the board. We need more youth peers. We need more youth peers that have exited and aged out of the foster care system and made some strides that they can impart to other youth. Foster parents need peer support from other foster and adopted parents. Biological families and kinship families need some sort of support from a peer support advocate. And they all need connections to services with people like them with lived experience for that kind of non-judgmental shoulder to cry on and upliftment and support to help heal, because relationships are healing. And if we improve our relationships and our outreach and get the support we need, then we are going to, in turn, empower our youth to move forward. And that's all I have.
Thank you. Seeing a few others that I think we can address. One person writes, if parents had the support that foster parents receive, they would be more successful. I think that's a really crucial point. And that's something that Families Together is uniquely positioned to say as a group, as an organization that really represents all the voices and all the different perspectives that represent family. And I can say as a policy director, it's something that we're especially attuned to. We are trying very hard to make sure that preventive services are available and easy to access, regardless, and this is a really crucial point, regardless if they have an open CPS case or not, or regardless if it's imminent removal from their home into foster care. Those are obviously crucial interventions that are better than just resorting to removal from the home. But all families need access to those levels of support, that primary prevention. We have to do more as a state to make sure that there's well-funded community resources across our communities. And that's something that we're actively pushing for right now and have been. So thank you, that's an excellent point. There's so much more we can do to support families.
I also like the idea of that some people added about supportive housing. That is very important, especially when you're on the road to transitioning, or if you're transitioning out of a residential facility. The supportive housing is incredibly important in order to build autonomy and the skills necessary, the life skills necessary for our youth to succeed. And also in terms of recovery, that's another thing that we can point to peers. Peers will fill a lot of gaps in the services. So if we have certified peer recovery advocates working with our youth, we also have another buffer of support to help close some of these gaps.
I'm seeing another question here, and this one's more about youth peer support. It seems like they're looking for advice on how to engage and build trust as a youth peer advocate with a young person they're meeting for the first time virtually during the crisis. I don't know if Zaria or even Brianna, if you want to take a stab at this.
It's really about being open. It's a lot of the same things that we tell you when we're meeting person to person. I know it's difficult during this time, but always having that check-in, being personable, utilizing your tools and strategies, connecting with other youth peer advocates, and seeing what they're doing and seeing what's working there. We do have our peer leader support and development meetings that we highly suggest you take advantage of to connect with fellow youth peer advocates.
And this is Brianna, just to bounce off of what Azaria was saying. There may be unique circumstances that could support you in building trust with that young person, and that's something that we'd be happy to explore with you. So I encourage you to reach out to your local regional youth partner and connect with them to be able to explore the unique situation that might be challenges to building trust with the young person that you're meeting with.
Do we have any more questions, or do you want to move on? Or
I'm looking through. I see one last one I think we can cover, and this is regarding the review criteria for when a child is removed from their home. And their example is when there's 4 children in the home and only one is removed. And I'll just say first off how crucial access to legal support is, how crucial access to advocates who have been there before are for a family in that sort of situation. The context in foster care is often, strangers who don't know the family, don't know the child, who have to make really quick decisions as they assess whether it's safe for a child to be in the home. And so it's crucial that a parent has advocates who they can bounce ideas off of, that can help them prepare for the various processes involved in such a proceeding. Can't emphasize that enough. Kim, is there anything you want to speak to on that?
well, I mean, it really does depend on, are we talking about the removal of one child from a foster care situation or from a biological home?
Yeah, it's not clear in the question.
Not clear in the question. Okay. I mean, because the supports, while they should be doing the same thing, would probably look a little different. You want to look to, number one, the reason for it. And I think that's some data that we should look at how often SIB groups are split up, which happens way too often. Sometimes there is a valid reason, and sometimes the reasons aren't entirely valid. Because when it's behavior, there's a reason for every bit of behavior. To go back to my original analogy, let's look at the environment that they're already in. Let's look at the family relationship they already have, and let's put in the supports needed to ensure safety, healing, consistent delivery of mental health services, consistent delivery of things such as intensive and home services, and even if needed, some crisis response services. But bottom line, the goal should be to keep families together.
It's a great answer, Kim. I think we're ready to move on.
Okay. All right. So, in what ways has COVID-19 impacted families and young people involved in foster care and mental health? What resources do we think may help? As I read these off, if you all can pop in some answers in the chat, and then one of my collaborators would graciously report out on that. Some of the things that are definitely needed are access to virtual contact with family. And let's say when we say family, we mean biological, kinship, chosen family, a former foster home that the youth has remained connected to. These are mentors. These are people who are in the child's life to embrace them and help them along into adulthood. I cannot stress the importance of consistent relationships enough. It is very important to foster consistent relationships. And during COVID-19, we weren't doing it that well prior. During COVID-19, things have gotten worse. I myself, as a foster parent, am having problems accessing my foster child who is in a residential facility. I want to set up virtual talks with my child, and this goes through a barrage of confusion, I have to say, as to who's going to be doing this. So, you know, I myself, I pay for Zoom, and I do this. I just get the facility to get him front and center on the camera so that I can continue to instill some level of hope and to have him know that we are his family no matter where he is. So that is very close to my heart right now. And then wellness and recovery action planning, and that is a no-brainer. Wellness is very important, and recovery. We need action planning that involves, again, everybody who's seated at the table for the youth, and that has to include who the youth has chosen as well. Participating in virtual opportunities. We need to be providing virtual opportunities for skill building training. We need to be providing virtual opportunities for special ed, for tutoring. We need to be providing a platform by which our youth can access training, skills, support, everything that they need moving forward. And of course, help creating a new routine, because we're entering into a new normal. So getting these platforms together now and providing this level of support virtually is going to help us to move into this new routine. And also having the mental health supports for those of us that aren't able to really shift into that new routine. That's difficult. That's very difficult for a lot of us, particularly if you have any type of autism spectrum or any other type of issue or emotional situation that is preventing you from making that shift. You need support in doing that. And then more educational support. That goes without saying. If our children are not going to be returning to school, what are we going to be providing them that covers every aspect of their needs holistically? What is a school social worker going to look like? What's tutoring? What is resource room going to look like? What are OT, PT, and speech? Speech is very easy to do virtually, but what does OT and PT look like? Again, now you're dealing with putting things on the adults who's caring for them to deliver these services. If an OT says, okay, these are the exercises that your youth has to be doing, and now they have to do it. So here's where the caretaker is going to need support from the system as well. And supports that are sustained as we begin to returning to a new norm. That goes right back to creating virtual platforms, creating more access via phone, telehealth, everything else to build that circle of support, and access to basic needs such as food. And that is definitely an ongoing issue, and that is an issue that needs to be solved, probably better solved regionally, but it still takes more dollars to be funneled into our system. And opportunities to make friends. This is a good time for those of you who are peer support specialists, youth or family, and you're on the call, those of you who are care managers or foster care case managers, and those of you who are caretakers. We have to start paving a road for the opportunity for socialization, for making new friends. So if you have an idea and your employer says it's okay, let's start providing access for some sort of a social support group, not necessarily clinical, but social. That's something that a youth peer advocate can do. That's something that a family peer advocate can do, or a foster parent. These opportunities are very important because, you know, like it says at the bottom, we can't go where the path may lead. We have to go instead where there is no path and leave a trail. And that's what we're doing now in this new norm. Lastly, which is really important, family court systems considering adoption proceedings as an emergency. That is something that is needed and needed now. There's a lot of foster parents, there's a lot of biological parents and kinship homes that want to move forward on things yesterday. And this slowdown due to COVID is slowing down an already slow process in the adoption proceedings and the permanency planning for the children that we love and care for. Next slide. This is an awesome, thanks Brianna, awesome little poster that includes all of your responses to this question. What aspects of your experience with foster care and mental health do you wish people were more aware of? More understanding of the trauma young people in foster care experience. That is very much needed. That is very much needed. And that's where training and education comes in, not just for biological families, for foster families, for the care and case managers, for the clinical world, for the community outside of that. Because understanding the trauma is going to help you become more informed and more culturally informed as well, because everybody responds to trauma differently. Every culture responds to trauma differently. And when you're in foster care, you may not have an opportunity to respond in a healthy way, because being in foster care it's duress, it's stressful as it is. So that can exhibit itself in your behavior. And too many of our youth get labeled bad. They get removed and put into residential facilities. Again, I'll go back to this a million times. We have to work on our environment. And part of working on our environment and what we feed our children starts with us, our homes, our community, the neighbors across the street. It starts with every one of us in every aspect of this youth's life. We have to work to nurture the soil in which our youth are growing. So understanding trauma is incredibly key to that. There's help in our community for all parties involved. There's a lot of help for a lot of people. There's a lot of help out there. Unfortunately, we're fragmented in New York State. New York State has a lot of dedicated people and a lot of passionate advocates. We have a lot of communities that are doing a lot of little things on their block or for people down the street or with their school. But we need things to come together cohesively under the umbrella of state funded and state sanctioned services and policy and procedure. Acknowledging the positivity and strengths parents and caregivers have. That's very key. We have got to really focus on not necessarily demonizing things that might go wrong with an individual, because everybody does something wrong, says something wrong. We have got to focus more on acknowledging the strengths. We have to be strength-based, and we have to learn how to pull that out of caregivers in particular, so that they understand the individuals they're caring for. And we have to understand that parents as well, biological parents, have got their own issues that they're facing, their own struggles that they're facing. But every one of us on this planet has a strength, we have a gift, we have a skill, we have something that we all need to help them tap into, so that they know that they will be able to move forward and appropriately care for their child at some point. So also understanding why young people may be acting a certain way and what they have been through, that speaks right back to trauma. Understanding that there is no bad behavior. So we have to really be focused on looking at the community that is experiencing the gaps and deficits in the foster care and mental health system, and we have to get the answers from them, and that's all of you. And I want to let all you know this very awesome quote from Harriet Tubman. Every great dream begins with a dreamer. Always remember, you have within you the strength, the patience, and the passion to reach for the stars and change the world. And that goes for every one of you on this call or webinar today. Copy it down. And advocacy really starts with self-care. Caring for yourself also has to do with advocating for yourself. Self-care plus advocacy equals self-advocacy. You're a foster parent and you see a gap, step up to the plate and make a move. If you're a youth that knows there's these gaps in the system, step up to the plate and make a better future, make a better present for yourself. So what does wellness look like for you right now? And I just want to see if anybody who wants to put in the chat. Brianna or Brad, if you monitor that, or Zach.
Yep, we're tuned in, waiting for responses.
We have to do something today that our future self is going to thank us for. So the things that occurred in the past, we got to fix this for the future.
Well, there's
Somebody,
oh, go ahead. Go ahead, Sarah.
somebody said taking breaks from work to exercise, meditation. So making sure we're centering ourselves, taking that time out to physically center ourselves is definitely a great way.
Very great.
Walks with my dog.
Oh, that's nice.
Utilizing your natural supports. That's what I'm hearing right there. That's awesome.
You all have great, those are really great responses. You have great ideas. And this is in no means going to be a self-care training, but it's good to hear back what you all are doing. And I think the next step in your self-care also will be advocating.
Somebody did say that working from home and remote learning is very stressful for them, and I think it's really important during this time to recognize that we're all in this together. Reaching out to each other and connecting to each other is so very important during this time, and having those opportunities to normalize as much as we can and just be together. I do want to kind of move on, though. We are running out of time, and we do have a lot of really important things to go over. So are we on the next one? Next slide. So on our next slide, I want to just point out that advocacy is wellness. We want to know how you are advocating during social distancing at this time. So like we were saying, social distancing is staying away from people, not from your purpose. From physically staying away from people maybe, but that doesn't mean staying away from them. It means connecting in other ways. So advocacy is wellness. So using this time, we'd like to highlight our needs and what we can do. So what can you do and what can we do during this time to make some change? Is really our big question for today. So somebody said attending advisory council meetings over phone. So yeah, getting involved with those advocacy areas and advisory councils, letting agencies like ours, Families Together, know what is going on and maybe some things that you feel we can and should be done to make changes. Contacting representatives, participating in virtual community awareness events, decorating my neighborhood green for mental health awareness. That's awesome. Strongly encouraging Zoom meetings, but at the least phone calls. I have increased our, so having more meetings with people, connecting more with people. Scheduling Zoom meetings in your personal lives. To connect with your family and friends. Actually, we tried Zoom, it was terrible. We went to Facebook. But definitely connecting in those ways. Reading policies and study related to peer work in a mental health environment. That's awesome. So just for the sake of time, I'd like to try to move along here too, but I'm so glad you guys are actually out there doing some things. So the next slide is what can we do? What can we do and what is being done, or in your opinion, what can be done to improve the experience of youth and families impacted by the foster care and mental health system? And our quote here is, when the world is silent, even one voice becomes powerful. So it's like you guys were saying, hanging up some of those, making your neighborhood green, just spreading the word, taking to social media, putting up pinwheels in their garden for Child Abuse Prevention Month. That's awesome. Educating yourself, getting involved. connecting and collaborating with other agencies, a lot of three-way calls with families. That's awesome. All right, I want to head on to our next slide while you guys are answering some of those. So how do we do it? What are some creative things that you are doing to advocate for change? And our quote here is, never doubt that a small group of thoughtful, committed people can change the world. Indeed, it is the only thing that ever has. So again, that really is highlighting some of those creative things that you are doing. I want to pass this on to Brad too for the next slide of how we can continue to do things.
Great, thank you, Azaria. So I do have some thoughts on how we do it. Advocacy is really crucial and important to me. I decided a long time ago when I was just a young college student who wanted to change the world that advocacy is how I'm going to be. That is my purpose. That is my wellness program. In addition to, you know, all the great things that I've saw, I try to do some of those stuff. Advocacy is something that I think helps me feel like I'm affecting change and impacting people for the better. And so there's a lot of different strategies now. You know, we have to move away from some of the traditional ways, like big lobby days in person, rallies outside of the Capitol, even sending letters. We ought to not do in a time of social distancing, but there are different ways, and this is really the perfect time to advocate during social distancing. And so, unfortunately, we had some great videos that Azaria and Kim had, or excuse me, that Zach had made regarding mental health and foster care advocacy, but we are experiencing some technical difficulties, but we can't share those. But there's other things you can do. And the question earlier that came up that we had raised about, you know, what do you wish people were more aware of in the foster care and mental health system? One of the best ways that you can put that stuff out there is telling your story, recording videos and sharing them as part of hashtag campaigns, getting the word out there, participating in even submitting your own opinion editorials to papers. They're always looking for free content. It's a beautiful thing. So if you have a story to tell, something that's really relevant to maybe some of the advocacy goals that we've talked about today, like the moratorium or the need for expanded children's behavioral health services, contact us and we can help support you in co-authoring articles that the paper can publish. And you know, you can have one meeting, you can affect one person individually, but these media markets are massive. You can reach thousands of people who may never have understood the challenges that children in foster care or families with mental health issues are going through and don't understand how they can support us. And so when you as peers share those experiences, that makes all the difference when we're trying to encourage legislators to do the right thing. That kind of thought process extends well beyond just editorials. You can engage with news outlets, reach out to reporters. You can tweet directly to legislators, tweet and use Facebook. We're also seeing some really creative ways of hosting meetings with legislators. So you can't meet with a legislator physically anymore, but all the legislators are dealing with the same thing we are. And so you can actually, and I've done this, is have Zoom meetings with your legislator, meet with them face to face via Zoom, and talk to them about the issues that your community is facing. And then there's some interesting ideas I heard. Painting the town green in support of mental health. That's a great idea. It's very visual. It gets people interested, and it's also a great excuse to get outside. And drive-by rallies. Now, this is something that we've seen used by many different groups. Rather than showing up in large numbers, big crowds, driving around the Capitol over and over again with signs and things painted onto their car. Really, really sharp ways that grab a lot of attention that folks can do. And if folks want to engage with some of the advocacy things that we're working on here at Families Together, you can go to ftmos.org/digital advocacy center. That's on our webpage. You'll see different letters and things that we've been submitting to the legislature, different op-eds that we've helped author that you can help engage with us on. Things like social media toolkits that you can tweet yourself. You can do it. If you don't have a Twitter, start one. You can follow me. I'll be your first follow. Yeah, these are some of the ways that in these times we can actually bring attention to our issues and make a difference. Next slide.
I just want to point out too, while we're changing slides, those advocacy videos, we are planning on posting those on social media. I think we'll be posting also this video on our website, I believe.
Yep. So these are examples of some of the different advocacy things that we're engaged with. You know, Zaria had pointed out the, you know, that we need to extend foster care for young people who were planning on aging out during this time or prior to COVID, and now their plans have been upended. This is a really crucial advocacy point that we're calling for children in foster care. And so you'll see this is a young person right here who is telling her story and doing that vulnerable work, but is making huge waves. Legislators want to talk to her. They want to hear from her. They want to help her. They want to help kids like young people like her. And this is the kind of thing that's going to make a difference. Personal stories, not numbers. And so we invite you to be a part of this. Next slide. I think we just want to invite everybody to share a little bit about what you want to do. What about what we've talked about today is appealing to you? What are some ways you're already getting involved? You know, we want to hear them, so go ahead and share that in the chat.
I also wanted to point out here too, like the importance of like hashtags and when you are out there spreading the word, putting up your posters and signs. You need to be able to like connect people, and a great way to do that is through those hashtags. And you can also find those videos we were talking about earlier on our social media accounts, and look out for those hashtags too, of how to connect and what people are using to connect others.
Yeah, and speaking of hashtags, we do have one that we started directly related to the moratorium. It's hashtag Pause Aging Out New York. And we have a social media toolkit on the Digital Advocacy Center that I referenced. It's right at the top. So we're going to be kicking that off this week. I think we've already started to post some things, and we're also having a press conference on Thursday with some young people and some advocates. So feel free to join us and start engaging in that. We make it really easy for you, is that we've made all the different sample tweets and who you should send it to.
And all of that's on the Digital Advocacy Center?
That's right.
The Digital Advocacy Center. Awesome. Also, you can reach out to our regional youth peer our regional peer advocates. I feel like that's, yeah. And then our parent advisors across the state, to just connect with us and connect with some of the things that we're doing and what other people are doing. Local resources. I know somebody asked about Long Island specifically. I definitely advise you to reach out to our people scattered throughout New York State. They're great resources for you.
And if you start with our main number on the website, and they will definitely direct you to the right resource. Okay. So we're getting ready to wrap up here, but Azaria and I found this quote and we thought it was very inspiring, and we want to leave you with something inspiring. So it's, I raise up my voice not so I can shout, but so that those without a voice can be heard. And that is really an incredible example of advocacy. It's not just about speaking up for yourself, it's about speaking up for those who don't have a voice. So if you are a caretaker who is a foster parent or a biological or kinship or just a guardian, raise up your voice. You need support. So reach out for it. Raise up your voice because the youth that you are caring for need support. You're a youth, and you, even if you've aged out successfully, raise up your voice because you don't want to see, you want people coming through after you to have a better experience. So still raise up your voice. And if you're a youth currently in the system, again, raise up your voice. All of us should be raising up our voice, because advocacy at its best is an exercise in empathy as well as self-care. So it is a wonderful thing to do. Nothing changes without the voices of those who are impacted by certain situations. So we have to ask for it so that they will know that we need it. So I want to encourage all of you today to take, even if it's a baby step, towards speaking up for some of the things that we spoke about today, even if it's just one thing. It's very important because nothing will change without your voice partnered with our voice. Help us, help yourself, and we'll help you, and all of us here at Families Together with lived experience are going to move forward, because we do want to make sure that things change. Zaria?
Of course. Change does take time, so it's very important that we are out there. These are some responses we did receive from you guys. Take one challenge at a time. So we asked everybody just some messages of hope for our listeners and for each other. Trust yourself and ask questions, get the services you need. This too shall pass, so hang in there. Never give up. Our ancestors, we've seen things like this before and we've gotten through it. So never let fear decide your future and keep pushing. When all hope feels lost, don't be afraid to turn to others. Find safe people you can rely on that can be hopeful enough for the both of you until you are ready to feel that way again. So thank you guys for submitting these. Breathe, be kind to yourself and each other, know you're doing your best, and believe in your strength. You have survived 100% of your worst days. That will always be one of our resonating quotes. So if you see any that you really adore, copy and paste them, hold on to them. And I just want to wrap up by thanking you for spending this extra time with us today. You're really doing amazing things, and always remember that you can make a difference. Our history has really, we've come a long way, guys, and it depends, our movement forward really depends on each and every single one of us.
Together we can do it.
Oh, also in the handouts, there are 2 files available that are letters from campaigns. We do encourage you to check those out for talking points and asks, very direct asks. So those videos that we shared, you can literally read those off and share those if you'd like to regarding mental health and foster care during this time. So hashtag it up, video it up, get involved, connect with us, connect with each other. Be creative, be loud and proud, because what you're doing is making a difference. So thanks again, guys.
Thank you.
They're also available in our Digital Advocacy Center, too. I'm not getting speaking points over here.
Right.
What else I forget?
So let's start, everybody.
All right. Thank you, guys. Thank you, everyone, for joining us today. If you haven't filled out the survey that we shared some of the results with today, please take some time to do so. If you're interested in participating in any of the advocacy efforts or want to join in on some actions that are being taken during this time, please do contact us. We are all in this together, and together we are stronger. So thank you all, and have a great day.
Yeah.